Hello guys, welcome to Pajon Imaging Hub. In today's patient and public education series, we'll look at how you can interpret your mammogram result by yourself. Welcome back. Your mammogram result contains or is expected to contain the following: patient identity, the clinical indication, the breast composition, significant findings, comparison to previous films, conclusion or diagnosis, then image quality assessment and recommendation. The patient identity help to ensure that it is the right patient that gets the result. The clinical indication guide the image reviewer or the interpreter to know what the complaint or the symptom is in interpreting the image. The breast composition, it reflects the content of the breast tissues that is presented in the mammogram. Then the significant findings are the findings that is seen in the mammogram that is significant in making diagnosis. I stated in the previous video I did, anytime you go to radiology department to do investigation that involve x-ray, they do ask you to come along with your previous film if there is any, if you have done any one before, for comparison. In mammogram, it is very important. So there is a section in the report that the radiologist or radiographer, depending on the case that is reporting the image, has to compare the present or the current image with the previous image you have done, if there is any or you have done any. Then after which the person now makes conclusion or diagnosis based on what he has found in the image. Then also he has to state the image quality that he used in making this diagnosis, how he see the image, whether it was obtained properly or whether there is a deficient in the image quality. It has to be stated so that people making use of the report will understand the kind of image that was used in making the diagnosis. And the last section in the mammogram report has to do with recommendation. The reporter has to recommend whether you should continue your normal routine screening, mammogram screening, which is expected that anybody more than 40 years of age should undergo at least once in a year. But there could be a case in the report that can demand that the patient undergo the mammogram in 6 months' time. So it has to be stated in the recommendation. Or if there is any other imaging that the patient need to do, maybe ultrasonography or magnetic resonance imaging, it has to be stated under recommendation. Let's look at the breast composition. This is reflected by the breast density and is a measure of the proportion of the dense breast tissue, that is the glandular and the connective tissue, to the fatty tissue. In other words, the breast is composed of two major categories of things: the glandular and the connective tissue in once, then the fatty tissue. So the proportion of this glandular and connective tissue to the fatty tissue reflect the breast density, as it can be seen in the image below. This breast composition is categorized into 4. We use the A, B, C, and D to represent these 4 categories. The first category contains less than 25% glandular and connective tissue compared to the fat. In other words, it contains more fat than the glandular and connective tissue. You can see the image. The second image contains about 25 to 50% glandular and connective tissue. The rest is fatty tissue. These white areas is the glandular and connective tissue, but the dark areas is the fatty tissues. You see this first one, you see almost all the breast tissues are fatty. Then the third one, which is C, contain about 50 to 75% of the breast tissue is glandular and connective tissue, these white areas. Then the rest of the black areas is the fatty tissue. Then the fourth, which is classified as D, contain greater than 75% of the breast tissue is glandular and connective tissue. You can see the white tissues. Then these tiny remaining dark areas are the fatty tissue. So what is the implication of this breast composition or breast density? The younger the patient, the more dense the breast is. In other words, a younger patient contains more glandular and connective tissue compared to the fatty content. And that is the major reason why they don't do mammogram, because it does not give a good diagnosis, because it's difficult to make out cancerous tissues or abnormal tissues from the dense tissues. So you can see in this image, everything appear white. Majority of the tissues appear white. So it's difficult to make out which part of this breast is abnormal. So for people that advance that have dense tissue, doing mammogram is difficult because when you obtain the image, interpreting it is difficult. So it's difficult to make out abnormality out of it. Such a patient being referred to other imaging modalities like ultrasonography, that is ultrasound, and the magnetic resonance, that is MRI, to complement the mammogram. It is expected that as you advance in age, the glandular and connective tissues reduces while fatty content increases. And that is why it's easier once you passes the age of 40, the fatty content increases, so the breast image is easier to interpret than patient below the age of 40 years. But don't forget also the other reason why we don't do mammogram to patient below 40 years is also because of the sensitivity of the breast to radiation, because radiation still have some negative effect. So we don't want to start that early, to start exposing the patient to radiation when we know that the patient breast tissue is dense and we cannot make out much from it. We usually consider the concept of justification in application of radiation. Now we look at the conclusion or diagnosis. In breast imaging, we use the BIRAD categorization to make the final diagnosis. BIRAD means breast imaging reporting and data system. So when you get your mammogram result, you may see this BIRAD categorization. Let me say BIRAD category 0, BIRAD category 1. So you have to know what they mean. BIRAD category 0 means that the test is incomplete. And it does not mean that there is anomaly or that the test is normal. Instead, it means that the reporter need additional imaging, like additional views of the breast or other imaging modality like ultrasonography, that is ultrasound, or magnetic resonance, that is MRI, to be able to make his decision. And if it is BIRAD category 1, it means that the result is normal. There is nothing to worry about. The recommendation is normally to continue your routine screening, which is expected that women of 40 years and above are expected to undergo mammogram screening at least once in a year. Then category 2 means there are findings, but they are benign, means it means that they are not cancerous. And these findings may be cyst or fibroadenomas. So in such a case, the patient may be asked to continue his normal screening. Or if the finding is disturbing to the patient, like it could appear as lump, they can do surgery and remove them. Then category 3, the findings are probably benign. They are probably not cancerous. Not that we are sure that they are not cancerous. They are probably not cancerous. They have more features that suggest that they are not cancerous than features that suggest that they are cancerous. So in such a case, a follow-up mammogram, the patient is asked to undergo another mammogram in 6 months' time to see the possibility of clearing some of the doubt. Such a patient that this diagnosis is made. In fact, viral category 3 has less than 2% of being cancer. Viral category 4, this category is suspicious category. It shows that the findings are suspicious of cancer or cancerous tissue. The potential for cancer in such patient is 20 to 35%. So in such a patient, biopsy is recommended to clear the doubt. Then the category 5, viral category 5, is very high suspicious of cancer. So in such a case, delay is not recommended. Biopsy is highly recommended so that the patient can know his stand and treatment plan can be started on time. Viral category 6, this category states that the patient is already known or confirmed cancer patient, and this patient probably is undergoing mammogram to monitor the treatment. So is already a known cancer patient. I want to state that in viral category 4, some mammogram reporters can categorize it into 3 categories or 3 subsection. They have the 4A, 4B, and 4C. 4A has a low suspicion of cancer, which is greater than 2%, but less than 10% likelihood of being cancer. And 4B is moderate suspicion, which is greater than 10% or less than 50% of likelihood of being cancer. And 4C, viral category 4C, is high suspicion of cancer, which is greater than 50% but less than 95% likelihood of being cancer. These are things you may see in your mammogram result, and knowing what they mean will help you to understand the interpretation and how to equally assist the caregiver in your management. Patients are expected to be a core team in their management. This is made easy when they know what they are being treated of or what the diagnosis implies. But I also want to remind you, as I do state in most of my videos that has to do with patient and public education, radiology diagnosis shouldn't be taken as one-off phenomena. Remember, the diagnosis is meant for you to take back to your clinicians who has access to your folder and other information and test result that you may have been sent, whose it is his responsibility to collect all this result and be able to know whether they are correlating or there is a need for further investigation. Thank you so much. Please like, share, and subscribe. Bye for now.